Do you see my, do you see my screen? Do you see where it says midterm exam study guide? Okay. So what this is, let me move this forward here, is that this midterm exam study guide and also the final exam study guide is already in the course syllabus, and it's been there since, we started the course. But here is just um a guide to help you what to study for. And again, what you need to review is really the textbook chapters that I assigned to you in the all assignments schedule. Also review the PowerPoints as well, the slide decks that we went over in class. And I know that some of the slide decks that we went over, I did it very quickly because of the time constraint that we had. And so I really recommend that you go over that, you know, fairly diligently. Because again, a lot of the material that I pulled to create those slide decks were pulled from the textbook. And I think that I mentioned this in the beginning of class before, is that do you need the textbook to take this class? Well, yes, you do. It is a required class material. So you need the textbook in order to pass, or be able to answer a lot of these questions, okay? So going through this case study, what you need to study for really is, again, looking at this, and it's nursing today, which is in regards to the working diversity and also the different types of work settings that nurses usually are employed at. Looking at the type of employment settings that nurses are at, which is the most common uh, place to work when nurses graduate, or even now, what work setting is the most common area that nurses work in? Does anybody have a guess? Hmm. Nothing in chat? You guys don't have any idea what the most common area where uh, nurses work?
Hospitals?
Huh?
Hospitals?
Okay. Yeah. Hospitals. Okay. Just a second. Anybody have a guess? I see clinic. What is it? Nursing homes? No, I wouldn't put it at the top. No. Okay. So I think you guys better take a look at that and determine or decide which of the top three of the most common work settings at hospital that nurses work in.
Everyone's putting it in chat.
Say again?
I said everyone's putting it in the chat.
Uh-huh. Everybody is putting it in the chat, but there's not a consistent answer. And so
Oh.
what that tells me is that you're not quite sure. So this is what I'm saying, is that you need to find out which is the most common, followed by the second and the third. Okay. Um, so next you need to look at the historical nurses and what did they do? What was their contribution to the nursing profession? Okay. So if I were to make a list of or terms for specific to a certain historical figure, what would that be? So, for example, um, author of the first um, medication book or pharmacy book, who would that be? Okay. Um, if I put a list of terms that said, let me think here. Crimean War, Lady of the Lamp, Notes on Nursing. Who would that be? Okay. So who would that be? Why don't you put it in chat? Who would that be? Anyone else? Okay. So you get the idea, right? So you need to know the contributions of these individuals um, in regards to, what did they do that really made them stand out and why we are looking at them today. Okay. How did technology improve nursing? How did it hinder nursing practice? So an example would be electronic medical record, right? It improved nursing tremendously because we're able to, again, um, create more efficiency in our documentation. However, the negative aspects of it is that sometimes with medical records, it doesn't allow you to be able to really do a lot of free texting or make comments in that. It just depends on how it is, how it's developed. Okay. um, know what the organizations are that are essential to nursing, the National League of Nursing, the ANA, just get an idea of really their importance. Also, on top of that is the agencies that also contribute to the accreditation of colleges, nursing programs. And we talked about the CCNE and the ACN and AACN. So really, what is the difference between all those colleges? Okay, what is significant? Which of those agencies would give accreditation to all um, nursing programs at universities and colleges, regardless if it's an LVN or whatever, or which of these agencies only accredit um, ADN nursing programs. So that's the differentiation you want to really look at in these organizations. The professionalism aspect, and I'm asking you, until you can put it in chat, is really define what the difference is between a profession and an occupation. What are some of the characteristics of a profession and an occupation? And also, nursing has sometimes not been considered a profession. And so what is it? What is the barrier with that prevents nursing to be really embraced as a profession when in fact it really is? So I want you to, and I'm asking this as a class, and I want you to put in chat, what is that one barrier that prevents nursing globally to be easily accepted as a nurse, as a profession? What is different about nursing compared to all the other uh, all the other professions where their professionalism is in question? So if you can put that in chat. Okay, I only see a couple. Anybody else? Okay, Alyssa Grijalva? Alyssa, do you have any idea? Alyssa, are you here? Okay. So I'm going to look at some of the responses. And Vi, you had said varying levels of entry. What does that mean? Vi Nguyen?
Hi. Can you hear me?
Yeah, I can hear you. Thank you.
Yeah, it's like varying the level for education for and try into the practice. It's like for in sorry, you can start to learn the nursing from ADN, PSN, or somewhere.
Okay. Okay. Um, Let me hold on here. There's someone that wants to come in. Hold on one moment. I'm going to stop sharing for now because I need to let this person in. Okay. Okay. So a couple more things. I think nursing involves a lot of physical work in different areas in the culture, regulations, standard nursing. Okay. So let me rephrase my question. Okay. Because I think some of you are going towards the right path and some of you may not understand what my question is. Okay. When you go into nursing, all right, as Vi said, there's different levels of nursing. You can be an LVN, you can be an ADN nurse, you can be a BSN nurse, MSN, whatever, because there's different levels of pathways. All right. Do you see that in any other profession? Do you see that in any other profession where you can go in and you can be a different level of whoever it is you want to be, like you want to be an accountant or you want to be a physician? Are there different levels where you can call yourself an MD or an accountant, but really not have the same level of education as everybody else? Okay. Fernando says the military. All right. Talk to me about that, Fernando, so I that way I can understand and I can learn too.
So, the military gives you like two pathways to join, and it's you could go to college first, get your degree, and go in and commission as an officer. Um, and there's multiple jobs, so I mean, there's different levels, there's different fields within the military. There's a combat rules, and then within the combat rules, there's combat engineers, which deal with demolition of roads, construction, like anything with really with building, building and destroying.
Okay.
And within and then you could go to, actual like infantry, guns, and all that stuff. But if you go to college and then you join and you go through the combat section, I guess, the person that got the degree will be an officer and will be essentially a supervisor starting off, and he will be in charge of 50 guys. So his title is still the same. He's still a combat engineer, but he's just now a supervisor. He's now um he's there to make sure that the planning and work gets done. And then while if someone were to just join right after high school, or what's called enlisted, you could progress through there also, but you'll go and be under him, I guess. If
Okay.
that makes sense. That's how I'm understanding it. It's kind of like um there's multiple ways. Like if say you go to college for 2 years and then you decided to join the military, you'll go in as a higher rank, like not an officer, but you because you didn't finish school, but you'll go in with already 2 years of experience. Like to say like they'll give you 2 years of military experience, or like there's ways to that they incentivize or they give incentives to people to join and more pay or whatnot. But
Right. Okay. Is the rank the same?
no, no, it's not.
The rank's not the same. Why is the rank not the same?
The levels of education.
Okay. So that's my point, is that the level of education is different. And in the military, you can have the same title, but you may be, let's say, Corpsman 2 or Corpsman 3, right?
Yeah, yes.
Okay, so, but until you get that education under your belt, and depending on the level of education will determine the rank that you are if you're an officer or not. Is that correct? And you're educating me, so I'm glad I'm learning from you, and thank you.
Um, yeah, yeah. And then it's like it's a little it is, but it's like also if you go in, right, and then like you outperform, say your times are faster than someone else or one like everyone's competing inside the military. So basically if you didn't go to school but you're just an absolute just stud that you're just knocking out everything just out the park, they'll promote you for that. They'll give you a but they're I'm trying to
No, I think I understand. I think I understand what you're saying. No, I do, and I thank you for that. I think where I'm going towards with nursing is this, okay? And again, it's that if you are an LVN, you can call yourself a nurse. If you are an ADN, you can call yourself a nurse. A BSN, whatever, you can call yourself a nurse. I think this is one of the things that the nursing profession is looking at and why the ANA paper had said, hey, wait a minute, why can't we have the entry level of nursing be a BSN? Because there are too many levels of education. Okay. And remember when I showed you guys that pyramid and I said, where's the line between a technical nurse and a professional nurse? That line was between an ADN and a BSN nurse. Okay. So the barrier is that there are too many levels of education, meaning that to get into nursing. Okay, let me clarify that. There are too many levels of education to get into nursing. What the ANA wants to do and what the nursing profession wants to do, and why there is an increase and there is an encouragement in all the hospitals for nursing to start advancing their degree is because we want to attain overall um, that nursing is a profession without any doubt, without any question. And so you may be saying to yourself, well, nursing is a profession. Yes, it is. Nursing is a profession, but let's make it a little more solid. Let's take away and this is what the profession is saying, let's have more advanced nursing or more nurses with a BSN degrees. And then for those BSN nurses to be more, gain their credentials in higher education. And so again, this is the barrier, okay? I think that there has been research where BSN nurses that take care of patients, their patients have been shown to have have better outcomes. Okay. It's not looking at the so much the skill level between an LVN and ADN, and a BSN, but it's because of the education that really can expand and how can I say this? The idea, the concept of how to improve patient care. And so with that higher level of education, you are exposed to things beyond just skill. You're exposed to more theoretical, conceptual things. So that way we can work towards patient care improvement. Okay. And so the studies have shown that BSN nurse patients that are taken care of by BSN nurses have better outcomes. Okay. And again, it's not to downgrade the ADN because remember, I was an ADN or downgrade an LVN nurse also, but it's just what the studies have shown. Okay. Any questions or comments or anything that, and again, you can disagree with me, which is great, you know. Any thoughts? Okay, I'm going to continue sharing my screen here. Okay. Um, So again, it's what is the difference between a profession and an occupation? And I think that in one of the slides, there was a table with two columns. One was a profession, one was an occupation. And again, it lists for you, what those differences can be. Okay. I just talked about the ANA paper. And so, look at what is the Brown report. And for those of you that have a book, why don't you look in your book and just share with us what is the Brown report, and then put it in chat. Anybody pull that up? Who wants to put in chat what the Brown report is? Nursing for Future. Basic schools of nursing and universities and colleges, efforts made to recruit men and minorities into nursing education. Okay. So, anyone else? Anybody else that want to put in a Brown, what the Brown report is? Okay, so so please know what the difference is. Is advocated for significant shift for nursing to go from hospital training to college level. Schools unable to meet demand for nurses. Okay, if you turn to page, see, 83, I think that's where it is. Let me look again. Okay. I had it highlighted. Now I can't find it. Okay, so exactly, Jason, and what you typed was absolutely correct. So again, the Brown report and the ANA really did look at the level of nursing education for entry-level nurses. And it is looking at not so much standardizing, but having an agreement that nurses that go into nursing should be at a higher level of education. And for that, in regards to the ANA paper and the Brown report, it is that 4-year degree nurse. Okay. So know what the difference between the Brown report is, or what the similarities is between the Brown report and the ANA paper. Know the roles and responsibilities of the ADN, BSN, MSN, DNP, and PhD. Okay, what is their role and responsibility? So I'm going to ask this question. All right. Let me see. So, a nurse that is a nurse practitioner. Okay. I would like you to put in chat, what nursing degree she would have? Is it a ADN, BSN, MSN, DNP, or PhD? Okay, I'd like you to put in chat a nurse that is a nurse practitioner. Okay, MSN. So with that nurse practitioner having an MSN degree, is this a general MSN degree or is it an APRN degree, APRN certification? Because there's two levels of MSN. APRN, you're right. Okay, so with a nurse with an APRN degree, all right, can she write prescriptions? Yes or no? Yes. Okay. So again, this is what differentiates between an MSN with a general degree also in regards to roles and responsibilities versus an MSN with an advanced practice as an advanced practice registered nurse. Remember, there are four, and it talks about this. There are four APN roles. There's a nurse practitioner, a clinical nurse specialist, a clinical nurse clinical nurse specialist, clinical nurse midwife, and a CRNA. So what responsibilities do they have? If I were to say I'm a CRNA, what would I be doing? What is my role and responsibility? Put it in chat. Kind of quiet. Okay. Yeah. Administer anesthesia. They can also do pain management as well. Okay. If I was a BSN nurse, what is my primary role and responsibility? Can I write medications? No. Okay. Providing patient care. Absolutely. Now, that's true for for the majority of these credentials, right? ADN, BSN. But again, there are certain specific roles that they can do. But yeah, it depends on the field, but patient care and bedside, right? So great. So if I were to say, what is the difference between a DNP and a PhD? Who has, let me put it this way, who has more the clinical focus, the DNP or the PhD? Yeah, you're the DNP, because remember what I said, if you look at that pyramid that I showed you guys, right? PhD is at the top. She is the think tank, and she thinks of all these wonderful things. And so what she does is she says, hey, I have this great and wonderful idea about improving patient care. So I wrote a paper about it. I published it in a journal, blah, blah, blah. Here you go, DNP. Now you can implement it. Okay. Create a program and implement it. So the DNP is more clinically based, whereas a PhD is more geared towards research. And really that is the difference between the DNP and the PhD as well. Okay. Any questions before I leave the educational levels? Do you guys, so again, understand really what the roles and responsibilities are between an ADN, BSN, MSN, DNP, and PhD, right? Understand what the levels of the APN roles are, the NP, the CNM, CNS, and CRNA. What do they do, right? What is the difference in their roles? And again, the idea is that the idea is that because MSN has two levels, it's a general MSN where you can become an educator, you can become clinical informatics, you can also specialize in with a general MSN degree. But another level of the MSN degree is those 4 APRN roles that I showed you. Now, the future is for those 4 APRN roles, the future of the nursing profession is that these NPs, CNMs, CNSs, CRNAs will have to get a doctorate level education. Okay, that is the future of nursing. That is the direction that a lot of the universities are going to now, is that they are offering these programs, advanced degree programs, but at a level of a DNP, which makes sense to me. And again, it is aligned with the fact that we need to bring nursing to a higher level of education. Okay. Nursing theories understand the difference between a grand theory and a middle range theory. Okay. And which is the theory? Is it the grand theory or the middle range theory that that is more of a blended clinical and theoretical research model? Which one is it? Okay. So if you remember that pyramid that I showed you guys, the clouds and all that, do you remember? Okay, go back to that. Okay, if you remember, where is the grand theory? Is it closer to the clouds, or is it closer to the ground? The grand theory is closer to the clouds, right? It's more theoretical, more abstract. The middle range theory is more towards the ground, the practical. Okay, it's the best of both worlds, of practical and theoretical, abstract. So the middle range theory is the one that is more blended. Okay, so again, look into that, look at that definition, those definitions as well. I want you to put in chat, and you can look in your book, define theory. Define theory for me. Perfect. Okay, thank you, Jacob. Right, defined philosophy. Okay. Someone define philosophy. Set of beliefs and about the nature of how the world works. Okay? So I will give you definitions, or I will give you terms, and you need to know what these definitions, these terms are. Okay? Moving forward, let me see here. Maslow. Remember our friend Maslow. Thank you, Yoreli. Perfect definition. Remember our friend Maslow. Okay. Maslow, what are the different levels of hierarchy with Maslow? Anybody? Let me see. Let's see who's here. Patricia, self-actualization, that's one level. Evan says physiological, safety, social. Perfect, beautiful, you guys. You know our friend Maslow. Now, if I were to give you an example of one of these levels, would you be able to identify which level I'm talking about? Okay. So when I say uh, uh, excretion, sex, water, what is it? Physiological. Beautiful. Okay. So again, know what they are. Kubler-Ross, our friend Kubler-Ross developed a model regarding how patients or how people deal with the phases of grief or the phases of chronic illness, right? If I were to say to you, give you an example of a patient saying, just want to go to sleep. I don't want to be bothered. I don't want to go out. I just want to sleep. What level is that? Anybody else? Depression. Yeah, depression. If I say, oh, I'm really healthy. I don't know. I think that doctor mixed up my test results. He better take it again because I am healthy as a horse. Denial. Right. I'm in denial. I can't believe what the doctor says. He doesn't know what he's talking about. I don't care what those results said. They mixed it up. I'm healthy. I'm not sick. I don't have cancer. So it's denial. So know those different levels. All right. Here's another one. Oh, God, if you make me healthy, then I will go to church every single day, for the rest of my life and, until I come to meet you. Bargaining. Okay, easy enough, right? You guys got it down pat. You guys got it down pat. Okay, Kubler-Ross, Maslow's hierarchy of need. Know them, know them, know them. All right. We talked about open and closed systems. We talked about nursing and how it relates to general systems theory. So understand what that is. What is the World Health Organization? How do they define health? Right? Remember I said, oh, guess what? We pulled out of the World Health Organization, which still boggles my mind. I can't believe it. But anyways, how do they define health? Understand, know that definition. What does it mean to have health continuum? What is that? What is health continuum? And what does it mean for the locus of control? And what is health belief model? Why is evidence-based practice important in nursing and in healthcare in general? Okay. Why? Because what we do as nurses is based on research, it's based on study, it's proven through literature, research, pilot studies, and because the fact that patients do do better with evidence-based practice when it comes to healthcare, and the fact that patients prefer and their preference is to agree to treatments or medications that are evidence-based, okay, and that have been proven as well. All right, so understand evidence-based culture or evidence-based medicine. Remember what I said is when you give your opinion to any healthcare member or nurse or especially physicians and also your executive nursing leaders, that you need to have evidence behind you. You need to be able to have literature behind you to be able to prove your point. Okay. You can't just say, well, it's because someone told me. Well, that'll just fall flat. You have to say, you need to be able to back it up with literature that you have read, that you have, in fact, looked at and analyzed. Okay. Culture. How does culture impact nursing care and how we treat our patients and how we give care to our patients? It's absolutely huge, right? What we believe is true for us or a necessity for us may not be the same belief or have the same value for a patient that you are taking care of that may have a different culture and have a different traditional beliefs regarding healthcare. Okay. Understand and know the difference between stereotyping and ethnocentrism. Okay, be able to give an example. Let me ask you this just for fun. Give me an example of a stereotype. Give me an example of a stereotypical statement. Anybody? Okay. So make sure you know the difference between stereotype and ethnocentrism. Okay. And I think that's it. Any questions? Any questions? Okay, I'm going to stop sharing. Okay, so I'm going to do one more thing. I'm going to share my screen again. Okay. Do you see my slide deck that says midterm final review?
Yes.
Okay, great. All right, so let's do a knowledge check here. And you can either call it out or you can, in fact, let's do this, okay? Either call it out or put it in chat, the answers, okay? So this is just an example. Okay, here you go. I want you to identify the different levels of nursing education pathways. Okay, so please put it in chat or call it out. Either way, whichever you feel comfortable with.
You mentioned we could just say it out to you, right? Just want to make
Yeah,
sure.
go
Uh,
for it.
I'll go for five. Number five is MSN or APRN.
Okay, is that a question?
Um, uh, no, no, it's not. No.
Okay, five is not. Five is not.
Well, okay.
Okay.
Let's see.
So, all right. So let's look at this. Let's look at it as class. One is diploma nurse. I gave you that. What's two? What's two? Someone say it. ADN. Okay.
ADN.
Okay. What's three?
BSN.
Okay. 4A. This is 1 degree, but I broke it up. What's 4A?
MSN.
MSN, general MSN, right? So that means you can become an educator, you can become a clinical informatics, you can become you can specialize in nurse management. Okay. What is 4B?
MSN with APRN.
That yes, MSN with APRN. And okay, what is 5?
DNP.
DNP. And and 6 is PhD. Okay. So these are the educational pathways. All right. Next is Tom has worked in the ER for 5 years and is thinking about returning to school for his APRN. He has an MSN from California State University, San Francisco. What are his options? Okay, so what's the first one to the left? The stethoscope. I'm giving you hints. Okay. What is, okay. What is the one with 3 people in it? What is the one with 3 people in it? Okay, what is the one with this one? The third one? Person putting somebody to sleep. Perfect, perfect. And what about the baby? Right. So let's see who they are. As soon as I can bring my cursor over there on the screen. Okay. So nurse practitioner, clinical nurse specialist, and CRNA, and the clinical certified nurse midwife. Okay. Can someone tell me what the CNS role and responsibility is? You can look it up in your book if you want, or you can just tell me. What does the CNS do? Experts in specific areas of clinical practice and provide leadership in improving patient care and healthcare delivery systems. Yes. So the CNS can be a specialist in, let's say, diabetic healthcare. They can be specialists in cardiac, but they do have a specialty where they have the greater knowledge. And because of that, they are asked to look at the entire methodology of how care is given and to develop improvements of care for patients in regards to nursing care. Okay, so thank you, Kayla, for that. All right, so here is another one. Christine works as an RN at the cardiac ICU at a 250-bed medical center in Des Moines, Iowa. She started working there after she graduated as an RN at her local community college. And after passing her NCLEX RN exam, what is the RN degree did she earn? Sort of a long scenario for one simple answer, right? ADN. Okay, let's see what the answer is. ADN. Why did you not say BSN? Why didn't you say BSN? Anybody? Because it's a community college, right? Okay. Kind of underlined it too, didn't I? I'm not going to do that at the midterm, just to let you know. This is just for practice. Okay. Can someone read this for me? Can someone read it for me? Sarad, can you read it for me? Sarad Gonzalez?
Yeah, can you repeat again, please?
Yeah, go ahead and read it for me, please.
Read the
Scenario, that
okay.
question.
Tammy has an MCN in nursing administration and wants to advance her education. Her goal is to work as nursing researcher at the university, teaching goal to to improve the quality of healthcare through evidence-based research. Which educational nursing pathway is the best choice for Tammy to reach this goal?
Thank you. And what is the answer?
PhD.
PhD. Absolutely. Well, I shouldn't say that, right? I mean, I should just look at, yeah, okay, PhD. All righty. Good question. You ready for the next one? Yes? Okay, here's the next one. RNs work in various settings. All right. So let's go through this together. Number one, what is the most common area where you will be working when you graduate, or the majority of nurses when they graduate? Beautiful. Okay. Number two, what is the next area or environment where you will be working or nurses will be working? If not in the hospital, what is the next one? Okay. Okay. Mostly everyone that's answering says clinic. Number three is, what is the third area where nurses will probably work? Okay. Number four, what is the next one? Nursing care where is the next area of employment? The fourth, schools. Okay. Okay. And what's the least? Okay. You guys want to see what the answer is? Yes? Here it is. Like I said, the majority of you are going to be working in hospitals. Okay. The next is ambulatory outpatient areas. And remember what I said is that hospitals are really looking at cost containment, right? So because of that, they're going to have their patients, if they need any kind of therapy or treatment, they're going to have them go to an outpatient or an ambulatory care center. So if you need physical therapy, you're not going to come to the hospital. It's going to be too expensive for the hospitals to continue to do that. At some point, you may go for maybe 2 or 3 times, but for long term, if you need physical therapy, you're going to go to an outpatient or ambulatory care center. Okay, so that's where the majority of you are going to work, or in some sort of where they need nursing care. The next one is home health care services, because again, it goes back to the cost containment. If for patients that need to be have their wound treated or have any type of nursing assessment, instead of them going to the hospital or staying in the hospital, then the nurses will go to you. The nurses will do these home health visits. That's where Lillian Wald created the Visiting Nurses Association, um, uh, pioneered that. Okay. And then the next is residential care facilities, and those are such as the residential homes, the Alzheimer's centers, rehabilitation centers. Those are kind of the things that that was the next one. And MD offices is the last. And the reason why I say the MD offices is there has been a lot of research, a lot of literature where physicians having a private practice is very, very costly because of not only hiring people to work for them, but also their medical malpractice insurance becomes to a point where it's just too much money to run. And not only that, but a lot of the insurance companies may not be paying private physicians that much, that a lot of money. So one of the things that is occurring, and this is why I put it in number 5, is that a lot of what the trend is, and I should say trend, the trend is that physicians are closing up private practices and are being employed by the larger healthcare organizations, okay, to work for because of the fact that it is too costly to run a private practice. So that's one of the reasons why I put it in 5. Not that some of you are not going to work for physicians, but I'm just giving you information regarding the trend that is occurring with private physician practices, not just in California, but throughout the United States. And again, it comes down to the cost of healthcare. Any thoughts or comments about this? Okay. All right. Tell me, number 1, who is number 1? And here are your choices. Who is number 1? Put it in chat, please. Anybody else other than Isabella? Okay. Number 2, who is number 2? Okay, who's number 3? We all know that, right? Yep, Florence. Okay. All right. Who is number 4? Yep, she's one of my favorites. Did I tell you that? Who's number 5? Okay, and y'all should know number 6. Y'all should know number 6. Okay, so let's see who they are. Number 1, Mary Elizabeth Seacole. And then number 2 is Margaret Sanger. We should know who she is. And number 3 is Florence Nightingale. Number 4 is Lillian Wald. And 5 is Mary Seacole. And of course, Clara Barton. Now, you're probably asking, well, is she going to have pictures on the test? No, I'm not going to have pictures on the test, but I will have their names on the test, and I will have their accomplishments on the test. You just need to know what accomplishments match with which nurse or which person. Okay. All righty. Maslow's hierarchy of need. Number one. What's number one? You can look in your book if you want. Okay, what's number two? Okay, number three. Number four. You guys are good. You guys are good. And number five. Okay. So let's see where they are. And here you go. Okay. Again, know the different levels of Maslow's hierarchy of need. Know what is involved in each one, right? So that way, again, I'm going to give you an example or a scenario, and I'll say, okay, what level of Maslow's hierarchy of need is this person in? Okay, so for example, Jack is an advanced practice registered nurse, and he is very interested or wants to learn more about building people's confidence and building people's uh, openness to different aspects of life. So which one would that be? Self-actualization or self-esteem? Oh yeah, it could be one or the other, right? I was thinking more of self-esteem, but it could also be self-actualization. But in my scenario, I'll be a little more concrete. All right. So again, this is just an example. Okay. Here's one. Knowledge check. Who wants to read this for me? Alondra, you want to read it for me? Alondra Rios?
Christian is a 40-year-old adult male, shy, uncomfortable around people, and has difficulty speaking up in meetings. When asked his opinion on issues, he always agrees with the majority of his colleagues because he feels my opinion is not important. Which of Maslow's basic needs is not being met in Christian?
Okay. Thank you. All right. Everybody says self-esteem. Okay. Any disagreements with that? No disagreements? Okay, so let's see what it is. It's self-esteem. Okay, you're absolutely right. It's self-esteem. So these are an example again of what I'm going to be asking you. Okay, here's a fun little activity. Using Maslow's hierarchy of need, what are the essential physiological needs for survival? Okay, and we'll do this as a class. And just kind of put yes or no on chat. Okay, protein bar. Okay. Bottled water. Okay, toilet. Okay, books. All right. iPhone. Okay. There's a few of you out there that are quiet. I need you to tap in into your vote. Okay. Tesla. Do you need a Tesla? I know you want a Tesla, but do you need a Tesla to survive? Okay. Watermelon. Yeah, I like to eat watermelon, especially during the summer. Yoga classes. Do you need yoga classes? Absolutely. Okay. Strong morals and ethics. Do you need strong morals and ethics? Okay. Pizza. Pizza, pizza. Do you need pizza? Yes, I love pizza. I want a combination with anchovies. I know you guys don't like anchovies. I love anchovies on my pizza. Okay. I know, Bella, ooh. Air. You need air. Oh, absolutely. Oh my goodness. Yes, you gotta feed those brain cells. Do you need tent? You need tent. Right. Religion. Do you need religion? Okay. Computer. Do you need a computer? Right? Right? How do you know you're going to have a computer, internet? Right? Okay. So good job, you guys. Here's what I think. Absolutely need a protein bar. Remember, I underlined physiological need, okay? Physiological need according to Maslow's. Bottle of water. Everybody said yes. Toilet. A couple of you said no. Remember that part of the physiological need under Maslow is excretion or waste, okay? Watermelon, again, is food. Pizza, you need pizza for food, and air, of course, you need. Now, I've had one of the classes say, hey, you need strong morals and ethics. Well, it doesn't fall under physiological need. In a way, you can argue, well, if you don't have strong morals and ethics, then you won't be able to survive, right? Which is true in a way, but physiologically, do you need it? And the answer is no. Okay. So again, something fun, but the point is no Maslow's hierarchy of need. Okay, Kubler-Ross. What's the first stage? First stage. Yeah, check. Oh my goodness. First stage. Okay, guys, weigh in. Very good. Second stage. Second stage. Okay. Third stage. Okay. Fourth. Good. And fifth. Very good. Remember, when you are taking care of patients and they're dealing with either personal loss of a family member or a friend or an illness. Unknown caller. Sorry. Sorry. That you will be dealing with their emotions. Okay. So don't take it personally. Do not take it personally. Denial, anger, bargaining, which is trying to gain control, depression, and acceptance. Okay. Knowledge check. An Olympic swimmer was in a car accident and sustained permanent injury to his spine, resulting in a loss of function of his lower legs. I have to start training for the next swim meet. My team is counting on me. What is his level right now? Okay. I have to take out these animations. Oops, oops, oops. What happened? Okay. This is denial. This is denial because he has not come to terms or accept the fact that he can no longer move his lower legs. He can't kick, right? So he is still at a point where he's saying to himself, oh my goodness, this can't be happening. This isn't happening. Okay, so he's in denial. Next one. Mary hosted a high school exchange student from another country when everyone sat down for dinner. Mary said, in the American culture, we use fork, knife, spoon, and spoon to eat. Is this an example of stereotyping, or is it ethnocentrism? Ethnocentrism. And it is because the statement Mary is saying is in America. So she thinks that her culture is better than that of the exchange student. Okay. All right, true or false? Evidence-based practice is a methodology for the delivery of patient care that combines research studies, patient data, clinical expertise, and the patient's preferences and values. True or false? True or false, guys? True. Very good. Thank you very much. True. Differentiate between grand theory and middle range theory. Let me ask you this question for sake of time. Okay. Which is the one that is more theoretical in concept? Is it grand theory or is it middle range theory? It's grand theory. Oh, correct. So the definitions are grand theory is a broad explanation of nursing phenomena based on observation and reoccurrence. Again, this is more of a theoretical, abstract concept, whereas a middle range theory is a merging of nursing research and nursing practice. And this is what is usually used, okay, not that it is, but it's usually the type of theories that is used for nursing research. Okay. Give me a definition or give me a term. The definition is it provides a transmission of knowledge to nursing students and explains nursing practice to other professionals. Is this a theory or is it a philosophy? Which one of these definitions does it match a theory or is it a philosophy? It's a nursing theory. Okay.